Have you ever noticed that the part of your body you never think about is often the one silently controlling everything you wish still worked the way it used to? And have you ever wondered why even when nothing looks wrong, something still feels off, I ask? Because I've seen this pattern in countless men over 50 who come to me whispering the same worry. Why isn't my body responding the way it used to? What most of them don't realize is that the real problem isn't where they expect. It's hidden in a small, overlooked area that acts like the command center for blood flow sensitivity and performance. Before you feel alarmed, stay with me, because what I'm about to tell you isn't meant to scare you. It's meant to empower you. I've watched men spend years blaming age, stress, medication, even their relationships, when the truth is often much simpler and far more fixable than they think. That tiny area, the one almost no one ever pays attention to, is like a traffic intersection that's been slowly clogging for decades. And when it gets congested, everything downstream suffers. Now, here's the part most men never hear. And the reason I want you to listen closely there is a 1-minute technique you can do at home privately and comfortably that can help decompress those nerves, unlock blood flow, and restore vitality in a way many of my patients describe as shockingly effective. Not magic, not hype, just physiology working the way it was always meant to. And before we go any further, let me tell you this: you do not have to accept decline as the price of getting older. I've seen men in their 50s, 60s, even 70s respond unbelievably well once they finally understand how this hidden point works and how quickly their bodies can change when it's stimulated correctly. So if you're sitting there thinking, could something this simple really make a difference? Don't go anywhere, because the answer is yes. And in the next moments, I'm going to show you exactly where that point is, why science is finally catching up to what traditional medicine understood long ago, and how you can activate it safely in just 60 seconds. Stay with me. This might be the most important minute you invest in your health this year. The first thing I need you to understand is this: your body has been sending you signals long before anything truly stopped working. Most men brush off those early signs, the slight drop in sensitivity, the slower response, the firmness that feels different than before, because they think it's just aging. But after years of working with men over 50, I've learned that these gradual shifts almost always trace back to one place, a small overlooked strip of tissue called the perineum. Now, before your mind goes to see the wrong place, let me speak plainly. This isn't about anything strange or invasive. I'm talking about physiology, something I see every week in my clinic. The perineum may look simple on the outside, but underneath, it's a high-traffic intersection of nerves, blood vessels, and the very muscles that determine how well your body performs. When traffic at that intersection slows, everything depending on it slows with it. Not overnight, but slowly, quietly, in ways men barely notice until the decline becomes impossible to ignore. And it's not just my clinical experience. Research from the American Urological Association in 2023 found that reduced perineal blood flow and pelvic floor tension are two of the strongest predictors of declining male performance after age 50. But here's the surprising part. Almost no one ever talks about this area because most men don't even know how crucial it is until their symptoms force them to pay attention. To make this easier to visualize, imagine your circulation as a highway system. For years, cars have moved freely. But as time passes, little bottlenecks form: a tight muscle here, a compressed nerve there, a vessel that's lost some flexibility. None of it stops traffic right away, but eventually those slowdowns add up and suddenly you're dealing with gridlock. That's the moment men finally walk into my office and say, I don't understand. Why isn't my body responding like before? And what shocks them most is that the problem rarely starts where they feel it. It usually starts right here in this tiny, ignored intersection that quietly controls the flow to everything else. Why does this matter so much? Because the perineum is the front line of the pelvic floor. This is where deep muscles responsible for engorgement pressure and nerve signaling all converge. When those muscles develop chronic tension, which happens to almost every man who sits for long hours, they squeeze down on circulation the way a tightened fist squeezes a hose. One of my patients once described it as a chokehold on blood flow, and honestly, it's the most accurate description I've heard. But here's where things get interesting. Once you truly understand what's happening inside this hidden point, the solution becomes surprisingly simple, far simpler than men expect. And this next part is where everything starts to shift. Now that you understand why this hidden intersection controls so much more than most people realize, let me show you something even more surprising: how easy it is to find it, and how often men go their entire lives without ever knowing it exists. I've lost count of how many patients looked at me with the exact same expression when I first guided them, a mix of disbelief and relief, as if they were finally discovering the switch no one ever told them about. The perineum isn't complicated to locate, but it is easy to overlook. Think of it as the soft valley between two landmarks, the scrotum in front and the anus behind. But what matters isn't just knowing between A and B. What matters is recognizing the precise spot where the tissue feels slightly different, not painful, not hard, but gently indented, almost like the center point of tension where everything beneath the surface meets. When I guide patients through this for the first time, I always tell them to slow down and pay attention to the way the tissue responds. That's because this tiny difference in texture is your first clue. Men often tell me the area feels a bit sensitive or kind of tender, and that response is normal. In fact, it's exactly what you're looking for. Sensitivity here is like a flashing sign saying, yes, this is where the traffic jam starts. Scientifically, this makes perfect sense. A 2022 study published in the Journal of Pelvic Health found that men with chronic pelvic tension often had noticeably higher pressure points in this exact region compared to younger men with normal function. It's not age that creates the tension, it's decades of compression, sitting stress, and lack of stimulation. The body adapts by tightening, and that tightening restricts both circulation and nerve activity. Let me paint the picture in a way that's easier to visualize. Imagine pressing gently on a sponge that's been squeezed too long. It doesn't spring back right away. It feels denser, heavier, almost stuck. That's what happens in the perineum. The deeper tissues lose mobility, the nerves become cramped, and the blood vessels aren't able to expand the way they used to. When you finally apply the right kind of pressure, you're not just touching the surface, you're waking up an entire network that's been asleep for years. One patient of mine, a 62-year-old man who'd been struggling for over a decade, told me, "I can't believe something this simple was the key to everything." And he was right. He had tried medications, supplements, and endless stretching routines, but he never addressed the tight, unresponsive tissue in this exact spot, the place where circulation, sensation, and muscle control intersect. And here's where things get even more interesting. The moment you find the right spot, your body gives you feedback almost instantly. Some men feel a warm release, others feel a subtle pulsing. Some simply notice the tension under their fingers, softening for the first time in years. All of these reactions are signs that you've connected with the right point, the command center of the pelvic floor. The goal is not to push or dig, but to create rhythmic, controlled movement that encourages fresh blood to enter and stale blood to leave. I often describe it to patients as helping the traffic move again. When you press with the right amount of pressure, firm enough to engage the layers beneath the skin, but never painful. You're essentially opening the clogged lanes one by one. Here's how I teach it in my clinic. Imagine the pressure you'd use to test whether a tomato is ripe. That soft, steady firmness is exactly what you want. Start with small circular motions about the size of a quarter moving clockwise for 30 seconds. This warms the tissue, relaxes the fascia, and gently increases blood flow to the deeper muscles of the pelvic floor. Then reverse the motion for another 30 seconds. This helps release tension held in the opposite direction and stimulates an entirely different layer of nerve endings. This isn't guesswork. A 2021 study from the Journal of Pelvic Neurovascular Therapy found that gentle, consistent mechanical stimulation of the perineal region improved localized circulation by up to 35% and significantly increased nerve responsiveness within just 2 weeks. It's no wonder so many of my patients report feeling a subtle warmth or pulsing during the first few sessions. The body is waking up pathways that have been dormant far too long. Let me share a simple visual that tends to resonate with men. Picture a garden hose that's been bent for years. Water still moves through it, but not freely. The pressure is weak, inconsistent. When you gently unbend the hose, the flow doesn't just return, it often surges back stronger than before. That's exactly what happens here. You're not forcing anything. You're restoring what should have been flowing all along. And what's truly remarkable is how quickly some men notice changes when they get this technique right. Some feel tension melting out of the pelvic floor. Others describe a sense of openness or warmth. A few even tell me they feel their posture shift, as if something deep inside finally relaxed. These reactions might seem small, but they are powerful signs that the system is responding. But here's the part I really want you to hear. The 60-second technique is only the foundation, because once you understand how to activate this point correctly, everything else, the oils, the timing, the long-term changes builds on top of it. And what comes next is where results go from interesting to genuinely life-changing. And now that you understand the technique itself, this is the moment when things get even more interesting, because what you use on your skin can completely transform the results. I've seen it countless times, 2 men doing the exact same massage for the same amount of time, yet one sees improvements within a week and the other feels almost nothing. And the difference isn't luck, it's the oil. Most men assume oil is just for comfort, something to make the skin glide better. But in the pelvic region, oil becomes a delivery system, a way to send active compounds deeper into the tissues that desperately need help. I can't count how many times I've watched patients' eyes widen when they realize that the right oil actually works with the massage, amplifying its effects, like adding oxygen to a fire that's been smoldering for years. Let me start with the one that stands above the rest, castor oil. This isn't some trendy ingredient. It's been used in medicine for centuries, and modern research finally explains why. Castor oil contains ricinoleic acid, a compound shown to reduce inflammation, soften dense tissue, and dramatically improve local blood flow. A 2020 study in the Journal of Integrative Health found that warm castor oil applied to areas of chronic tension increased microcirculation by up to 40%. That's an enormous shift for a region as stubborn as the pelvic floor. When I guide patients through their first session with castor oil, they almost always describe the same sensation: warmth, a gentle spreading heat that feels like the tissue is finally coming alive. And that's exactly what's happening. The oil penetrates deeper than most people expect, helping soften muscles that have been locked tight for years. But I know some men prefer something lighter, and that's where coconut oil comes in. It's gentle, antibacterial, absorbs quickly, and works beautifully for men with sensitive skin. Virgin coconut oil also contains medium-chain fatty acids that support hormonal balance and calm local inflammation, small things on their own, but surprisingly powerful when combined with the technique you're already doing. Then there's black seed oil, which is less common but incredibly potent, rich in thymoquinone. It's been used for thousands of years in Middle Eastern medicine, especially for vitality and male health. I've had patients who didn't respond to anything else tell me that black seed oil was the turning point, the moment things shifted from, I hope this works, to I can actually feel the difference. Sometimes I recommend a blend castor oil for depth, coconut oil for comfort, and just a few drops of essential oils like peppermint for circulation or rosemary for nerve activation. But here's the key. Essential oils are extremely concentrated. A few drops per ounce is all you need. Too much can overwhelm the tissue instead of helping it. Let me explain why all of this matters. When your perineum is tight, undercirculated, and stiff, it doesn't just need stimulation, it needs support. The right oil softens the dense layers, reduces friction, increases glide, and allows your fingers to reach the deeper structures without force. And this is what accelerates results. I've watched men who struggled for months suddenly progress in a matter of days once they paired the technique with the right oil. It's like trying to open a stuck door with and without lubricant. The difference is night and day. And what's even more exciting is that when you combine the proper oil with the correct rhythm of pressure, the entire pelvic floor begins to respond in ways men don't expect. They feel lighter, looser, warmer, more connected to their body. And that's when real change begins. Because now that you know how to prepare the tissue, the next step is learning when to do this technique so your body responds at its absolute peak. And that timing is far more important than most men realize. Once you understand the right point and the right oil, there's one more factor that determines how powerful your results will be: timing. And this is the part most men never think about. They do the technique whenever they remember, sometimes morning, sometimes evening, sometimes right before they need it, and then they wonder why the results feel inconsistent. But your body doesn't work the same way at every hour of the day. Your hormones shift, your circulation changes, your nervous system toggles between stress and relaxation. So the timing of this technique is not a minor detail. It's a multiplier. Let me start with the most effective window first thing in the morning. When a man wakes up, his testosterone is naturally at its peak. That hormonal surge increases vascular responsiveness and nerve sensitivity, which means the tissue reacts faster and more fully to stimulation. I've seen patients who struggled for months suddenly break through plateaus simply because they switched their routine to morning sessions. The body is already primed. You're just tapping into what nature has set in motion. The second most powerful window is right before bed. And no, I don't mean right before intimacy. I mean right before you actually sleep. Evening massage works for a different but equally critical reason. When you stimulate the perineum and relax the pelvic floor at night, you activate your parasympathetic nervous system, the branch responsible for deep rest, nerve recovery, and hormonal regulation. Studies from the National Institutes of Health show that nighttime parasympathetic activation improves nocturnal blood flow and increases the likelihood of stronger morning erections, which is one of the strongest indicators of pelvic and vascular health. There's a third timing option that I recommend for specific men, 2 to 3 hours before intimacy, not minutes before hours. That gives the tissue time to relax the blood flow patterns, time to reset, and the nerves time to recover from direct stimulation. Men who do it right before intimacy often overstimulate the area and end up feeling numb or distracted. But those who do it earlier, they come back later with better responsiveness and more confidence than they've had in years. And let me tell you something important I've seen over and over again. The consistency matters more than intensity. A perfect 1-minute session every day beats a 5-minute session once a week. The pelvic floor responds to repetition, not force. Think of it the way you think about brushing your teeth. It's the small daily habit that creates long-term change, not the dramatic effort done inconsistently. One of my patients, a 58-year-old man who'd been frustrated for years, transformed his results simply by structuring his timing 1 minute every morning, 1 minute every night. That was it. Within 3 weeks, he reported better control and better responsiveness and fewer nighttime bathroom trips. His exact words were, "It feels like someone finally turned the lights back on." That's the power of timing. When you work with your biology, instead of fighting against it, the body reacts faster, stronger, and more consistently than most men ever expect. And the best part, timing is completely in your control. No medication, no equipment, just awareness. Because now that you know when to activate this point, the next question is how often you should do it and how to avoid the common mistakes that quietly slow progress without you even noticing. Now that you understand when your body responds best, the next piece of the puzzle is knowing how often to use this technique. And trust me, this detail matters more than most men realize. Over the years, I've seen 2 common patterns: men who do too little and see slow progress, and men who do too much and accidentally irritate the tissue. The sweet spot is surprisingly simple but incredibly precise. Let me start with what I recommend to nearly every patient: 1 minute a day. Not 10 minutes. Not random sessions whenever you remember. Just one consistent, intentional minute. Think of it the same way you think about training a muscle. You don't grow stronger by overwhelming it. You grow stronger by stimulating it regularly in small, effective doses. Your pelvic floor works the exact same way. During the first week, I usually advise men to go slow every other day. That gives the tissue time to adapt, especially if it's been tight or neglected for years. After that, once the area begins to soften and respond, you can move to daily sessions. It's amazing how often men tell me that the moment they switch to daily practice, just 60 seconds, they finally start to feel consistent progress. But here's something I really want you to understand: twice a day is not automatically better. Some men try to speed up results by doubling the routine, and they end up doing the opposite. They overstimulate the tissue, irritate the nerves, and create a kind of fatigue in the pelvic floor. The goal is activation, not exhaustion. If you ever feel soreness or lingering sensitivity, it's a sign to slow down, not push harder. And this brings me to the most common mistake I see: pressing too hard. Men are conditioned to believe that more pressure equals more effectiveness, but the perineum doesn't work like a knot in your shoulder. It responds to precision, not force. A study from the International Journal of Pelvic Function found that firm but gentle stimulation increased blood flow by 28%, while deep, aggressive pressure actually reduced it by triggering protective muscle tightening. This is exactly why I emphasize treat it like a control panel, not a pressure point you need to attack. Another mistake is doing the technique through clothing. I know some men try it out of convenience or discomfort, but fabric dulls the sensation and blocks the subtle feedback your fingers need. Without skin-to-skin contact, you can't feel the tissue soften, you can't adjust pressure accurately, and the oils you're using can't penetrate the layers that need them most. It's like trying to read Braille through gloves. You miss everything important. Positioning is another quiet saboteur. If your hand is strained or your body is twisted, you won't last long enough to build a habit. I often teach men to lie on their backs with their knees bent or sit on the edge of the bed where their arm can move freely. Comfort isn't optional, it's what makes long-term consistency possible. And finally, there's the mindset trap, expecting overnight results. This technique isn't magic, it's physiology. The perineum has often been tight compressed and understimulated for decades. You're retraining muscle patterns, restoring blood flow, waking up nerves, and improving tissue mobility all at once. That's a lot to ask of an area that's barely been touched in years. Most men begin noticing subtle shifts within 2 weeks and more profound changes between 4 and 6 weeks. But the men who see the biggest transformations are the ones who stay consistent long after the early wins. Because the real secret is this: once the tissue becomes healthy, relaxed, and responsive, you're not just restoring function, you're preventing decline. This shifts you from repair mode into maintenance mode, and maintenance is always easier than recovery. And now that you know the right technique, the right oil, the right timing, and the right frequency, we can finally talk about something even more important: how this technique creates benefits, far beyond performance benefits most men never expect, but absolutely feel. Now that you understand the technique, the timing, and the frequency, it's time to talk about something men rarely expect: the benefits that go far beyond performance. And honestly, this is my favorite part to share because it's where most men suddenly realize this isn't just about one area of my health. This is about my entire quality of life. I can't tell you how many patients came to me thinking their only problem was sluggish blood flow or inconsistent responsiveness, only to discover that the tension in their pelvic floor was quietly affecting everything from their bladder control to their lower back. The pelvic region isn't isolated. It's the foundation of your stability, your posture, your mobility, and even your nervous system. When you release chronic tension here, the effects ripple outward in ways that surprise almost everyone. Let me start with one of the most common improvements men report: better bladder control. Many men in their 50s and 60s assume that dribbling urgency or nighttime bathroom trips are just part of getting older. But in so many cases, the real issue isn't the bladder, it's the pelvic floor gripping too tightly and refusing to coordinate properly. When the perineum softens and the nerves decompress, the bladder finally gets permission to function the way it's supposed to. I've had men tell me they went from waking up 3 times a night to sleeping straight through until morning, something they hadn't experienced in decades. Another benefit that shocks men is the reduction in chronic pelvic and lower back pain. This makes perfect sense anatomically. The pelvic floor is connected to the hips, the low spine, and the deep stabilizing muscles. When those muscles are tight, they pull everything out of alignment. But once that tension releases even slightly, it's like resetting the base of the entire skeletal structure. I remember one patient, a 55-year-old cyclist, who told me, "I didn't just feel better down there. My lower back felt like it was 20 years younger." And then there are the benefits men don't even realize are connected, like improved posture, better core engagement, and increased stability during exercise. When the perineum relaxes and blood flow improves, the pelvic floor starts coordinating again with the diaphragm and abdominal muscles. This isn't just theory. A 2019 study in the Journal of Functional Movement found that men with relaxed, well-coordinated pelvic floors had significantly better core strength and balance compared to men with high pelvic tension. But here's where things get especially interesting: the neurological shift. Many men describe feeling calmer, clearer, and more grounded after doing this technique consistently. That's because stimulating the perineum activates the parasympathetic nervous system, the system that lowers cortisol, slows the heart rate, and tells the body, you're safe. I've had men tell me they breathe deeper, think more clearly, even feel more patient with the people around them. When your nervous system stops living in constant tension, your entire emotional state changes. Some men also notice improvements in hip flexibility, reduced groin tightness, and even fewer hemorrhoid flare-ups, because improved blood flow supports healthier tissue throughout the entire lower region. These aren't small benefits, these are quality of life upgrades that ripple into daily comfort, mobility, and confidence. And here's the part that ties it all together. When the pelvic floor becomes healthier, everything depending on it becomes healthier too. Blood flow improves, nerve signaling improves, hormonal responsiveness improves, physical comfort improves, confidence improves. One tiny overlooked point begins to influence the entire system. And now that you understand how powerful these full body benefits can be, we can finally talk about something just as important: the advanced techniques and small habits that take your results from good to dramatically better, often in a fraction of the time. After seeing how many systems in the body wake up when this technique becomes a daily habit, the next question I always get is there anything I can do to make the results even stronger? And the truth is, yes, absolutely. There are simple, almost effortless additions that act like accelerators, turning a basic 60-second routine into something even more powerful. And most of them take less than a minute. The first enhancer I often recommend is breathing, not just any breathing, but the slow controlled 4-4-4 pattern. Inhale for 4 seconds, hold for 4, exhale for 4. You'd be amazed how many men forget that the pelvic floor is directly connected to the diaphragm. When you breathe deeply, your diaphragm expands downward and gently massages the pelvic muscles from above. In fact, a 2021 study from the Journal of Neurophysiology showed that synchronized diaphragmatic breathing increases pelvic blood flow by up to 18%. That means your technique doesn't just work better, it works faster. Another enhancer that pairs beautifully with the massage is heat. Not intense heat, just a warm compress placed on the perineum for 3 to 5 minutes beforehand. Think of it like warming clay before you shape it. The tissue becomes more pliable, the muscles relax more easily, and the oil you apply penetrates deeper. Men who add this step often describe the massage as smoother, warmer, and more responsive, and that responsiveness is exactly what you want, especially early on. On the opposite end of the spectrum, a short burst of cold after the massage, something as simple as a chilled washcloth for 20 or 30 seconds can stimulate circulation through contrast therapy. Warmth expands blood vessels. Cold constricts them, and the switch between the two creates a pump-like effect. It's the same principle athletes use for muscle recovery applied to one of the most vascular areas of the body. Stretching is another tool I encourage men to use, particularly hip flexor and inner thigh stretches. The pelvic floor doesn't work alone. It's part of a chain of muscles that include the hips, adductors, and lower back. When those surrounding muscles are tight, they pull on the pelvic floor like ropes tightening a net. But when they're flexible, the pelvic floor can move freely and respond instantly. One man I treated, a 59-year-old runner, told me, I didn't realize my hips were choking the whole system until I loosened them. That's how interconnected everything is. And of course, hydration plays a bigger role than most expect. Good circulation relies on good blood viscosity. When you're dehydrated, your blood literally moves slower, your tissues stiffen, and your body struggles to clear metabolic waste. But when you're hydrated, everything flows easier. It sounds simple, but as a physician, I've seen men transform their results just by drinking enough water throughout the day. These enhancers aren't required. The technique works even without them. But each one amplifies your progress, turning a 1-minute routine into a complete system for restoring circulation mobility and nerve function. And when you combine them consistently, the changes compound. Your pelvic floor becomes more responsive. Your posture improves, your sleep deepens, your confidence grows. That's why I call these enhancers the accelerators. Because now that you know how to multiply your results, it's time to talk about something just as important: how to build this into your daily life so it becomes effortless, natural, and sustainable long-term, not just a temporary experiment. Now that you know how to accelerate your results, the next question becomes, how do you actually make this stick? Because the truth is, even the most effective routine in the world won't change your life if it fades after a week. What I've learned from years of working with men is that the biggest breakthroughs don't come from intensity, they come from consistency. And consistency becomes effortless only when you build a habit that fits naturally into your life. One of the simplest ways to do this is to link the technique to something you already do every day. I often tell my patients to pair it with a morning ritual right after a shower, before brushing their teeth, or before getting dressed. Habit psychology shows that when a new behavior is tied to an existing routine, the brain accepts it faster and resists it less. It becomes automatic, not something you have to remember or force. Another powerful strategy is keeping your oil where you'll actually see it. This might sound trivial, but it's not. Behavioral studies from Stanford show that visibility increases adherence dramatically. When men tuck their oil in a cabinet or drawer, the routine disappears with it. But when it's on the nightstand, next to their toothbrush or beside their vitamins, the brain registers it as part of the plan. I've had so many patients tell me that this one tiny change doubled their consistency. Tracking progress is another tool I find incredibly effective, not obsessively, but intentionally. Instead of focusing on day-to-day fluctuations, give yourself a few seconds each night to jot down how your body feels, tension level, comfort level, bladder control, or just overall well-being. Most men don't notice subtle improvements in real time, but when they look back at their notes after 2 or 3 weeks, the changes become undeniable. And those small wins build motivation like nothing else. But there's something even more important: don't fall into the all or nothing trap. Men often tell me, I missed a day, so I figured I might as well skip the next one too. That mindset kills progress faster than anything else. This routine doesn't require perfection, it requires rhythm. If you miss a day, just pick up right where you left off. Your body doesn't lose progress from a break, it loses progress when you stop altogether. And finally, I always tell my patients this: once your body starts responding, don't treat this as a temporary fix. Treat it as maintenance, the same way you maintain your heart, your muscles, your joints, or your diet. Because preventing decline is always easier than repairing it. When men keep this technique in their life, long after the early improvements, they stay stronger, healthier, and more confident as the years go on. And here's the beautiful part: once you've built the habit, it doesn't feel like a chore. It becomes a quiet moment of self-care, a way to support the system that supports so much of your daily well-being. One patient told me it's the only routine that gives more than it takes, and he was right. Because now that you know how to make this practice natural and sustainable, there's There's one final piece that ties the entire journey together, the mindset shift that turns a simple technique into a long-term transformation. Now that you know how to turn this routine into a natural part of your life, there's one final piece I need you to understand, and it's not physical at all. It's your mindset. Because in every man I've worked with, the biggest transformation didn't happen in the muscles or the nerves or the blood vessels. It happened in the way they saw themselves. And this shift is what turns a simple 60-second technique into a long-term rebuilding of confidence, energy, and identity. Most men over 50 carry a quiet fear, a fear they rarely admit out loud, the fear that the best days of their body are behind them, the fear that decline is unavoidable, the fear that once things start slipping, there's no way back. And I see that fear in their posture, in their hesitation, even in the tone of their voice when they first sit across from me and say, I don't feel like myself anymore. But what I've learned after years of treating men is this decline is not destiny. It's often just neglect, not intentional neglect, not careless neglect, just the natural result of a culture that never taught men how to care for the deeper parts of their health. When you finally start giving attention to the perineum, the pelvic floor, and the circulation beneath it, you're not just treating a symptom, you're reclaiming a part of yourself you thought was gone. And that reclamation does something powerful. Men begin standing taller, they breathe differently, they carry themselves with the quiet confidence of someone who is no longer waiting for failure, but expecting improvement. I've watched men who once felt embarrassed, uncertain, or defeated suddenly show up with hope in their eyes, not because of me, but because of what their own body told them the moment it began responding. This mindset shift is supported by science as well. Studies from the University of Wisconsin and UCLA show that when men experience improvements in pelvic function, their levels of cortisol decrease, their sleep stabilizes, and their emotional regulation improves. In other words, the body and mind repair together. When you restore circulation and nerve flow, you also restore a sense of control, and that psychological impact is just as important as the physical one. One of my patients, a retired 63-year-old engineer, said something I'll never forget. After a month of practicing this routine, he told me, I finally feel like I'm participating in my health again, not just watching it fall apart. That's the kind of transformation no medication, no supplement, and no quick fix can give you. That comes from you, from the small, consistent choice to care for an area of your body that has carried you your entire life. Because at the end of the day, this technique is more than a solution. It's a reminder that your body still listens, still adapts, still heals, even in your 50s, 60s, or 70s. And when you give it the right kind of attention, it responds with more strength, more vitality, and more confidence than you ever expected. And now that you understand the science, the technique, the timing, the habit, and the deeper emotional shift, you're finally ready for the part that brings everything together. The conclusion that shows you exactly what this journey means for the rest of your life. As we come to the end of this video, I want you to remember one thing. Your body is not failing you. It's inviting you to finally give attention to an area that has been overlooked for far too long. This 1-minute technique isn't magic, and it isn't meant to replace medical care. It's a simple, powerful act of maintenance, the same way you care for your heart, your joints, or your diet. And when you support the pelvic floor, you support so much more than function. You support your confidence, your energy, your sleep, and the way you show up in your daily life. So please don't just watch this and walk away. Give yourself 30 days. 1 minute in the morning, 1 minute at night. Let your body show you what it's capable of when blood flow returns, nerves wake up, and tension finally releases. I've seen men in their 50s, 60s, even 70s reclaim strength they thought was gone forever, not because they were lucky, but because they chose to take one small step every day. And if this video helped you understand your body in a new way, do something for yourself right now. Save this video so you can come back to the technique whenever you need it, and make sure you subscribe to the channel and turn on notifications, because I share new medical guidance every week, real science-based advice to help you protect your health, your vitality, and your quality of life as you age. Before you go, I'd love to hear from you. What part of this technique surprised you the most? Your comment might be exactly what another man needs to hear to finally take action. Thank you for spending this time with me today. Take care of yourself. You deserve a healthy, confident, energized life at every age, and I'm here to help you get there.